translation in 3 languages. So if you need, there is a small thing that you can use it to have the translation. Yeah, look, like here, like this one. Maybe Andres, would you help us to tell them about the translation?
Para decirle a la gente cómo está el servicio de interpretación. ¿Nos escuchan? Pregunto si se escucha en español. Can you hear me? Testing English. Can you hear me? Would you let me know if English is coming through? English. Channel 2 Spanish.
And canal 4 Portugués.
Channel 4 Portuguese.
Canal 2 Espanhol.
Channel 2 Spanish. Channel 3 English. And Channel 4 Portuguese. So once we have interpretation services, okay? Good afternoon.
Yes. Para a Organização Pan-Americana de Saúde, Organização Mundial de Saúde, celebrar hoje o Dia Internacional
Organization to celebrate International Nurses Day. We will discuss nursing education. I have with me the director of the Department of Health, PAHO, WHO, who will start with introductory remarks.
Silvia. Thank you very much, Silvia. And good afternoon, everyone. It is once again a pleasure to be with you. Once again, time flows quickly. I remember that last year we had quite a celebration, a very active and important celebration last year, and it just flew by very quickly. So we've done more work and work that you did with an important product that will be presented today during this celebration. I also wanted to greet all of the countries that are connected, that are following us online today. We have a lot of people connected via WebEx in English, Portuguese, and Spanish. And so, therefore, I also wanted to extend to you the most cordial welcome to today's session. First, the issue that, or the topic, rather, that was selected for this International Nurses Day is quite timely, really quite timely. As you know very well, in 2014, the organization started with a huge debate on the concept of universal health coverage and its relevance for the region of the Americas. Currently, countries approached our directing bodies, governing bodies, and they asked the organization to define what this universal health coverage implies for the Americas. We had a lot of debates within WHO and other institutions where they pushed for this universal health coverage, and considering the context in the region of the Americas, governments and ministries of health asked PAHO to kick off a debate on this issue. What does this mean, or what does this represent for countries in the Americas? Then, on the basis of all that, we triggered a lengthy process, complex process that began a difficult process at times, because we are in a region with so much diversity, countries with a lot of resources, more resources than others, persistent inequalities, different contexts, different populations, cultures, their own different unique cultures, and health systems that have been built in a very different way from one country to the other one based on the history, the background, the culture of the countries, and the values and principles that have been adopted by the various countries. So in this debate, countries took this education as a profound education, because for many years they have not had education with the level of depth in the region as to where health systems are headed in the region. And the discussion was concentrated on a debate on the values and principles on which health systems ought to be built. Some countries said that it is not a matter to ensure a nominal coverage. Others said that that was not true, that it goes deeper than that. And so countries arrived at a consensus to say one thing. They said that the concept of coverage is important in itself. And what is important in order to ensure funding mechanisms, to ensure a certain infrastructure, the resources that are necessary in order to ensure the coverage, nominal coverage, because many countries have nominal coverage, but it is not effective. What happens in many countries is that they have barriers, important economic, geographic, cultural barriers, which prevent people from having access to health services. So what the region said in this very same hall in June, and then in room A in September, was that for the region of the Americas, what we wanted to do is for every person to have access to universal health coverage and universal health services. So these are the two aspects that have to be discussed. So we started with this major work. We have Amalia, who's the head of the Services and Access Unit that is coordinating this part of the work. And with all countries in the discussion processes, but at a different level, not only the provision of services, which is important, but political debates as to where this is headed based on the 4 axes of the strategy that was adopted. And we've seen that in the last 3 years now, since the adoption of this resolution, that the countries do have a clear vision of what they want for a health system based on the strategies presented in the document. But their major challenges, significant challenges that still persist with the organization of services, primary health care, the quality of the services, governance, structures, and mechanisms for guidance of political processes. And more than anything else, there are 2 major issues that prevent the countries from moving forward with the strategic line 1. And the strategic line 1 of all these strategies is to expand, enhance access to health services that ought to be inclusive, of quality, comprehensive. And so in order to do that, it is not only to ensure this, but to expand a proactive process to bring health services to the populations that need it. 2 aspects, and at times important challenges that countries have in this regard. First of all, funding, financing, there are limitations, difficulties, limited fiscal space in many other countries, lack of capacity to have accumulation of resources, payment to the points of provision of services, and all these things that at times are difficult to settle within the system itself. And the other thing that we've seen is the issue of human resources for health. And it is that currently it is said that the region of the Americas has a huge gap in terms of absolute figures of human resources for health. And also an unequal discussion or distribution of resources in the systems themselves. So this means that there are a lot of resources, physicians and nurses that wish to work in urban centers that don't wish to work or don't have the necessary conditions in order to work in the rural areas and marginal areas, which also has implications regarding access and quality of health services. They've done a lot of work on savings, financing, and countries are making a headway considering the context in the region in economic terms that continues to face challenges in order to bring adequate financing to the system. But we have perceived that there was a more thorough analysis missing in terms of human resources. And last year, after all these considerations, countries themselves asked the organization to think a little more about this issue of human resources. What do we need? How can we make it to get there? What do we need to do? And to have a more thorough analysis on the context of human resources and obviously within this nursing. in this context. So we begun another process, and this year we're about to present to governing bodies a regional strategy about human resources in order to bring universal health access and universal coverage. Not human resources for the sake of human resources, but human resources for a system that is being transformed towards these major objectives that have been defined by countries. And these strategic lines within this strategy that we're contemplating and discussing are three. First, to strengthen governance and human resources, and not only in terms of a planning process, being the heads of professional cadres, but much more strategically to analyze where the country is headed in the future, where the system is going, and what does this mean for the production of human resources. What needs to be done by the country now in order to respond in 5 years, 10, 30 years from now, so that they will have the people, the adequate professionals, in order to meet the needs of the system. The second element is linked to access. Access to human resources that are necessary, as well as working conditions, because as we said in our previous analysis, in fact, there are huge challenges in all countries in the region, from Canada, the US, Argentina, and Chile, in order to ensure that the human resources that are being produced have the appropriate conditions in order to work in the areas and the services where they're needed. Then we're proposing a whole set of actions for countries to truly ponder upon the processes of the production itself, of incentives to ensure that we can have resources in those places where it is needed. And the third line is linked to something that I've discussed or that is brought to our attention today with the issue of education. Education. This is such a basic issue for the achievement of human resource strategy and for universal health coverage that we need a huge approach on this. What is being proposed by countries in the document that will be submitted to the Governing Council is that the countries want a more thorough discussion between health sectors and education. The way countries perceive things now is that the educational sector, on the one hand, is going in this direction in order to produce what will be considered as appropriate by universities, training centers, specialization centers, and sometimes, and this is very clear in the publication that you will see today, sometimes what the system needs, yes, we do need these professional cadres, but in fact, what we need is interprofessional teams in order to ensure primary health care, first level of care. And then it is with this approach that we've seen in the study that you carried out, and I wanted to thank you and to commend you for the quality of the work done. But when we read the document and when we see the abstract that comes with it, to me, the most striking thing that we've seen in the publication is the last one, and I will read this in English.
Also, a paradigm shift in nursing education to include more training in primary health care. Esto es uno de los mensajes yo creo que es fundamental que necesitamos hacer para todos los países.
This is essential for all countries. I believe that nursing has a huge presence in the health of the region of the Americas. Most of the labor force is seen in this professional cater, but this is happening with other professionals too. There are processes that sometimes are more geared to clinical training in hospitals, which obviously is important, but what is mostly needed in countries is information linked to promotion of health, prevention of diseases, first contact with a patient, quality at a high level in the first level of service, the contact with the family and with the community. And this is what we can truly do in order to make progress with health in the region of the Americas. So once again, I wanted to congratulate you for the work you've done this year. I believe that what you bring to us is very important, and also within the strategy, as it will be presented starting in June of this year in the governing bodies of the organization. So you can count on our full support to continue moving forward with this work that is being done. I believe that we should truly do advocacy in order to promote the results of these studies, in order to bring them to countries to show the inequalities that exist as regards the availability and the capacity to produce the professionals that are needed in the health system. I'm not saying that we're not producing nurses or physicians, doctors, we are producing them. But sometimes the capacities that these people have or the skills that they have are not in keeping or at up to par with what is needed by the population. So thank you very much, and let us move forward.
Muchas gracias, Dr. Fitzgerald.
Thank you very much, Dr. Fitzgerald. And now, continuing with the rest of the agenda, we will present the result of the study that was carried out, and I will make the presentation now.
Y el título del estudio es...
And the title is Status of the Education of Nursing in Latin America and the Caribbean, or Nursing Education Towards Universal Health. And I wanted to say that this presentation was prepared by the whole group of authors, but mainly by Sabrina Micael, here to my right, and Linda Wilson, here to my right also. The three of us put together the data and the presentation that had already been prepared by the rest of our colleagues. So we will present the context where the study was made, the situation of nursing education in the Americas, a more general context, the objectives, the methods, the results, and the conclusion of this work. So once again, the work of the Pan American Health Organization that Dr. Fitzgerald has already presented on the strategy for universal access to health and universal health coverage, UHC. That was the context that was used as a basis for the planning of the study. So it was based on that strategy, what we call universal health, that was used as a basis for the entire study. But not only the strategy that we then call once again of universal health, where, as Dr. Fitzgerald already said, human resources in health are essential in order to attain universal health care. And this document that was launched in September 2016 by the High-Level Commission on Health Employment and Economic Growth, established by the United Nations in cooperation with the Pan American, or rather with the World Health Organization and other agencies. This document proposed 10 recommendations for the transformation of the staff in the health sector, looking towards the attainment of the SDGs. The high-level committee proposed 10 recommendations, but the third recommendation empowers a transforming education of high quality and life training so that all health educators will have skills that can be adapted to health needs of populations, and that they be able to work to their best potential. So this is a specific recommendation on education, but it also talks about an education that transforms. So the issue of transforming education had been covered by other documents. One that was launched by Lancet, which is the head professionals for a new century, and then some documents from the World Health Organization on the framework for action on interprofessional education and transforming and scaling up health professionals' education and training. So the transforming education of health professionals and the promotion of interprofessional education and transprofessional education are necessary reforms in education in order to strengthen health systems. The World Health Organization defines transforming education as the sustained expansion on the reform of education professionals in order to increase the quality, the quantity, and their relevance. The vision of transforming education is, inter alia, of an active educational institution, sustainable, with a dynamic curriculum that is sustainable, that supports a learning environment, including a good physical structure, and also we need better alignment between educational institutions and health systems. As part of the educational reforms proposed by this document launched by Lancet in 2003, we find the promotion of an interprofessional education and transprofessional education that will bring down silos and will emphasize strategies for non-hierarchical cooperation in varied teams. So one way or the other, it was these documents, all these documents, which led to the study. We have nurses and midwives that constitute most of the labor force in the health sector. Data on human resources in nursing from PAHO, as you can see, show a huge variation in the number of nurses per 10,000 people in the different countries in the Americas. Canada, the U.S., and Cuba, the three countries had with the largest number, and countries at the end of this figure, such as Haiti, Honduras, and the Dominican Republic, have the lowest number of nurses. However, besides the change in number, we see a huge change in levels of the initial training and education for nursing, both in the countries in the Americas as well as at a global level. Therefore, to have good education, nursing education, preparing students in order to respond to the needs of health systems and work that is carried out by professional teams is essential. Another table which shows the number of nursing schools in the Americas. You can also see that we have here Brazil with 796 nursing schools, then followed by the U.S., and then followed by Mexico, Canada, Colombia, Chile, Peru, Ecuador, and then it goes down. And we also have countries where there is no nursing school. Around more than 2,300 nursing schools is the number of the schools that we already have in this region. Now, in connection with the number of nurses, graduate that have obtained a PA per year, our data that have not been analyzed, we have 270,000 nurses approximately in the region. they graduate, this is what they graduate a year. The U.S. followed by Brazil, and then Mexico, Canada head this table with the number of graduate nurses a year. And I say that the data is still being analyzed because you will recall that not always the country that has the largest number of graduate nurses or the number of nursing schools has the largest number of human resources in nursing. Therefore, we need to analyze the situation, and we're already planning that here at PAHO in order to assess what is the impact and why graduate nurses trained within universities are not in the labor market. What is the relation between the number of graduates and the employability of these professionals? Now, in connection with two countries, we have here for you to be able to assess the number of positions in nursing schools. We have data for Brazil and the U.S. So as you can see, Brazil has or offers 160 positions in face-to-face courses and 106,000 seats in distance courses, remote courses, and a year. And the U.S. offers 147,170 annual places. So clearly, the U.S. has the largest number of human resources in nursing, but Brazil, that offers many more courses and many more places in these courses, doesn't have such a large number of nurses in the labor market.
Now, the study that we're going to present on education and nursing, starting in September of 2015, when this group sat around a table in a restaurant and started discussing nursing education and what could be done to better understand what could be done in education and nursing. We were at an event. We sat down at that table. Now, there were some directors of the collaborating centers with us at the time. The same ones who are here with us now from Colombia, Mexico, the U.S., the president of Aladep, and those of us from PAHO. And nearly 2 years later, after much work, the study was concluded.
E aqui estão os autores. A Micael, aqui. Levanta-te, Sabrina. Aqui conosco. Adriana Félix, que foi interna em 2015, está em Brasil. Linda Wilson, professora emérita. Lisa Teseus, que não está aqui, ambas del Centro Colaborador em Enfermeria Internacional de la Universidad de Alabama, em Birmingham. Laura Moran, presidenta da Associação Latino-Americana de Escolas e Faculdades de Enfermeria. Rosa Zárate Grajales, professora e diretora do Centro Colaborador para o Desenvolvimento de Enfermeria Profissional em la Escuela Nacional de Enfermeria e Obstetrícia da Universidade Nacional Autônoma de México. Temos aqui também a decana da Escola de Enfermeria, também está com nós outros, Dolores Arça. Linda McQuarrie, Linda, por favor, professora coordenadora do Centro Colaborador da Universidade de Illinois em Chicago. E as colegas Maria del Carmen Gutierrez Agudelo, Jaqueline Molina de Uriza e Nathalie Rosso Gutierrez, da Associação Colombiana de Faculdades de Enfermeria, e que está aqui representada por sua vice-presidenta, Fabiola Castellano Soriano. Os objetivos do estudo foram dois. O primeiro, evaluar a situação da educação em enfermeria em la região de las Américas, e determinar em que medida os programas de enfermeria a nível de grado em América Latina e el Caribe estão preparando a los egresados para que contribuam ao logro de la saúde universal em la região. La metodología fue presentada, el proyecto fue presentado al Comité de Ética de la Organización Panamericana de la Salud y la población destinada para el
And the population for this study included all of the nursing schools that have undergraduate programs in nursing in Latin America and the Caribbean. Now, it was very difficult for us to have access to all of the people from these nursing schools, and that's why we had to use everything we had: social networks, PAHO lists in the countries and regionally, the Regional Observatory of Human Resources for Health, international nursing networks, the data from the Latin American Association of Nursing Schools, contact information from ministries of health, national associations, and so forth. And much more work was necessary for us to obtain this list. We used email to contact schools and to invite them to take part in the study. And the study started in May of last year, and it went until September. So from May through September of 2016, we had Sabrina and I here from PAHO. We had to work very hard to ensure broad participation from all of the nursing schools. We did an exhaustive bibliographic review, and we created the instrument, which you see here up on the screen. Its first stage, in which we addressed this model with data on structure, processes, and results. There were questions about the structure, processes, we looked at the number of students, professors, the school's policies and guidelines for classroom and laboratories. On the process, we looked at the syllabus, study programs, clinical practice, and also where graduates ended up working, and if the skills that they needed for that job were actually learned at the school where they studied. Now, this instrument was reviewed, revised a number of times to be certain of its validity. We had 5 different experts on firming from Brazil, Colombia, Mexico, Uruguay, and a couple from PAHO. And so we made the necessary changes based on suggestions made by the group, and we sent directors and deans who took part in that meeting held in September of 2015, some of whom are here, and we had the deans of the nursing schools, and we gave them this instrument for them to use in their schools, after which it was sent to 15 different schools of Latin America and the Caribbean, the U.S. and Canada, for the purpose of another evaluation. 5 schools received this instrument in Spanish, a couple in English, a couple in Portuguese, and we received response from 14 different programs or schools. And the group also assessed all of these suggestions and comments that these experts gave. This instrument was put in the SurveyMonkey format and sent in via email to the deans of the schools. Well, some nursing schools, they're called deans, and others, they're called directors. And the data, as I said, was collected between May and September. The analysis of the data was done by groups based on language and geographic region, because the instrument was sent out in the 3 languages. We use the SPSS statistical analysis program. Now, in Brazil and Mexico, that data was looked at individually, given how many nursing school participants there were. 5 different groups were decided upon for evaluation: Brazil, Mexico, the Andean area and Southern Cone, minus Brazil, Central America, and the Caribbean, Latin American or Spanish-speaking Caribbean, and the non-Spanish-speaking Caribbean. Now we have 68 different items for analysis purposes. Now, let's turn to the responses. Of the 2,300 nursing schools that I said exist in the region, we had information from 1,100 nursing schools. After this great effort, that's how many we ended up with. Now, we invited each one of these 1,100 nursing schools to take part in this effort, but we only received 246 schools by way of response. Now, all necessary efforts were made. No efforts were spared to get these nursing schools to respond to the questionnaire. But we got 246 responses. Now you can see how many schools responded to this instrument, headed up by Brazil and Mexico. There were schools we reached out to by email, and the country has done an excellent job, and we ultimately ended up with more schools responding to the instrument than those which we actually contacted ourselves here at PAHO. Now, on this table, the publication itself has all of the information. This is just a summary about the total number of professionals in full-time and part-time nursing schools, broken down by the highest level of education. Now, 5,338 nursing school professionals working full-time were identified in the 240 some odd schools. 15% had undergraduate degree, 12 specialty, 34 the master's, 39% had a doctorate degree, being the highest level of education. Brazil has the highest number of people with a doctorate degree because Brazil has more postgraduate nursing programs. If we exclude Brazil, the overall percentage of professors with a doctorate degree goes from 31.3% to 8.3%. And our goal then is for us to raise the number of professors with a doctorate degree. Now, the number of hours of clinical experience in the primary health care units and clinical experience in hospitals, which we already addressed. Dr. Fitzgerald addressed that. For the overall sample, what we see is that the proportion was 0.63%. Now, what this means is that nursing students acquire the vast majority of their clinical experience in hospitals. And the proportion, if you look in the case of non-Latin Caribbean, was an average of 342 hours in primary healthcare units or community environments, with a total of 1,300 hours in the hospital. This goes to show that in the Caribbean, students of the Latin Caribbean spend almost 4 times more time in hospitals than in primary health care clinics. In the case of Brazil, we have an average that's a little bit better, 792 hours in primary healthcare centers, vis-a-vis 949 hours in hospital settings. Generally speaking, however, nursing students are being trained much more in hospitals than in primary healthcare centers. Now, this can be a challenge for the country to achieve health promotion, that is, to ensure access to professional nursing services in the primary healthcare centers. Now, regarding the items on the scale, the average was between 3.53 and 4.65. 61 of the 68 items had an average over 4.4. That gives you an idea of how well these schools are doing. Now, given the positive direction of this instrument, the items with averages under 4 and 4.4 were analyzed for the purpose of suggesting to the nursing schools those areas in which they could invest more to obtain a better result. Here we have some areas with an under 4.0 average. These are the different areas in which the schools said they had the hardest time. Regarding resources, what we see here is that there is sufficient access to the internet for students and professors, or there needs to be. There needs to be infrastructure for people with disabilities. We have to make sure that universal health is a part of the school's overall mission. This term isn't being used entirely yet, but we're striving toward that. Ongoing education policies is necessary for professors, and the experiences of the professors in primary health care areas needs to be broadened. This can be a factor that goes to show how unavailable, how few hours there are that people spend in primary health care centers, because people tend to be getting the vast majority of their experience in hospitals. There should be appropriate laboratories for students. There should be collaboration with international nursing schools, and professionals from other areas need to be employed here to achieve interdisciplinary work. Schools, nursing schools should be allowed to hire professionals from outside nursing. There needs to be communication technology, information technology brought to bear to ensure the best possible technology in the classroom. Preparedness for emergencies and disasters, environmental and global health is something that isn't usually covered sufficiently in the curriculum. Complex systemic thinking needs to be further developed. Research methodology needs to be enhanced. This regarding the training of professors who have a hard time at this, and therefore students end up having the same difficulties as far as carrying out research. Critical thinking needs to be taught, interprofessional education, and simulation experiences need to be made available in healthcare. As regards the evaluation, improvements need to be made to the regular evaluation of the study of the program of studies. Those programs in which students have the opportunity to take part need to be assessed. The results of these evaluations need to be conveyed to educational authorities and professional organizations. The instrument asks if the school shares the outcome of these evaluations with national authorities or with the health ministries, education ministries, as well as other professional organizations and associations. And what we saw was that gave us a low score, low result on that. The graduates should be evaluated themselves. Now, the article talks about the need for improvement in the study plan and infrastructure, it also shows that schools have offered other learning experiences at the primary healthcare center. The students simply need to be given more exposure to these primary healthcare centers. And professors use didactic methods that offer opportunities for students to take part in individual one-on-one learning. Close to 40% of the schools offer bibliographic resources on universal health. Now, skills in public health, policies in that area, community evaluation, all of this needs to be enhanced and worked on and taught by professors. But there are some areas, as I've said, in which improvements can be made. And this is a recommendation by the group of authors of PAHO that we make it to the nursing schools and to the professors who are listening in to us right now here today, which is the International Nursing Day, in which we are concerned about the future of nursing, especially the education of nurses. And the clinical experience in primary health care needs to be improved upon, needs to be enhanced. There have to be more professors with a doctorate degree, better trained doctors or professors with doctorate or master's degrees. Now there's an action plan for the region for the purpose of implementing, or rather stepping up, increasing the number of professors with a doctoral degree. We have to enhance laboratories and equipment made available to help students to develop necessary aptitudes for health care. For the sake of the patients, for their security, simulation equipment is used, different equipment for the purpose of simulation is used to train future nurses, this for the safety of patients. And so more money needs to be invested in labs and equipment, such that schools can make it that much safer for the patients and ensure that students have these opportunities. There has to be an interprofessional team, that is, different professors are working together. This is something that needs to start from the first years of training to see how to best work in teams, interdisciplinary teams with professionals from different disciplines to increase the number of hours spent in primary health care centers. Now there's a need to stress skills, complex systemic thinking, problem solving, evidence-based research, learning about the principles of methodology in research, interdisciplinary approaches, accreditation of schools, and the ongoing training of professors and hiring those that have experience in health clinics, primary health clinics. Now the results will make it possible for nursing schools to come up with strategies to enhance the preparation of students that will contribute to universal health. Now, we would like to offer special thanks to all of the nursing schools, their deans, directors, professors who have taken part in this effort. Thank you very much. Now, after this presentation, I would like to ask the authors of the study who are here with us at the table, because they are going to answer some of the questions. They will discuss some of the findings of the study, also information from their own experience, and if we have time toward the end, then perhaps I can answer a few questions from the virtual audience that's listening in to us. First, I would ask Dr. Linda Wilson, Emeritus Professor from the University of Alabama at Birmingham School of Nursing, to come forward. Linda, please. Come here and bring your paper up front with you. Laura Moran Peña, President of the Latin American Association of Schools and Colleges of Nursing. Bring your name plate, please, Laura. Come up front to the head table. Rosa Sarti Grajales, Professor of the National Autonomous University of Mexico, School of Nursing and Midwifery. Linda McCreary, Associate Professor from the University of Illinois at Chicago College of Nursing. Fabiola Castellanos Soriano, Vice President of the Colombian Association of Faculties of Nursing. Come forward, please.
El formato va a ser lo siguiente.
The format's going to be as follows. We're going to give you some questions, ask you some questions, and then give you 10 minutes each. Try to be very concise and objective in your responses, because this will make it possible for us to give you our full attention, and we'll give you the opportunity to answer the questions that the audience listening in virtually will be asking of you. So you don't have to follow any given order in your responses. That's up to you. And you don't have to answer all of the questions. No one person has to answer all of the questions. If you see that a given response was already sufficient, we can move on to the next question or next person. Now, the first question then that we have, that we would really like to hear what you have to say about, is that there are numerous recommendations, as we saw in the study, to enhance nursing education toward universal health care, among which, what do you think are the crucial ones in your country or in the region, and why? What is the recommendation that you think would be the most crucial for your country and for the entire region? May I begin? Good afternoon, everyone. Good afternoon. And I also greet all of those people listening in virtually. I would like to express thanks for having been invited to take part in this panel. And I think something that could be crucial in the region of Latin America and the Caribbean would be, first, we need to see a nursing education as a social phenomenon with different aspects and different perspectives for analysis and intervention, and that we have to conceive of it as a phenomenon in which you have coming together global, regional, and national and local aspects, and vice versa. I think that's something that has to be taken into account. And at the same time, this phenomenon has contextual factors such as political, geographic, economic, social, cultural aspects that come together. And so when we talk about recommendations for training in nursing for Latin America and the Caribbean, you have to take that into account because Latin America is a mosaic that's quite heterogeneous. Now, I think some other crucial aspects for the region would have to be that nurses who head up work teams that are intersectoral happen, taking into account decision makers across different fields, health, education, the economy, and labor sectors, with a view toward moving toward further regulation in nursing schools and practice. Now, there's evidence, literature that shows that when you see the labor force in health and nursing from a more comprehensive perspective, that's when you can really achieve results and success in universal health processes. This would make it possible for us to have more comprehensive processes, as Dr. Fitzgerald himself said a moment back, not just thinking about planning systems for human resources, but rather seeing them with a view toward all these other elements that he raised, aspects such as governance, access to health, and education.
Another issue that I want to bring to your attention as crucial is the need for promoting evaluation or assessment processes for the quality of higher education, as well as accreditation processes. Both undergraduate as well as postgraduate having as a goal not only obtaining a license. So the importance is not so much getting an official document that attests to the quality, but maintaining continuous improvement of nursing schools through their improvement plans, because that is truly what enables us to move forward. Something that came out of the study and what should be duly emphasized is that we should include in all these assessment processes all stakeholders involved. This means leaders of institutions of educational schools, but also health, professors, students, and obviously users of nursing services as well as employers. We also need to work on the definition of essential skills in each one of the educational systems in engineering, in nursing by countries, which would enable us to optimize the use of those resources available by giving priority to primary health care. The study performed shows that there's still much to be done in this regard in the region. For example, as you've already heard, regarding balancing the number of hours devoted to practices in hospitals and community practices. And last but not least, I would like to point out the following. I'd like to say that we need to have in Latin America, as a framework, collaborative work. And this is enabled by international associations, by national associations, but it also seems to me that we have to work on changing the image of what it means, what collegiate participation entails, and work in networking. We need to dispel the idea that associations or partnerships are abstract beasts, because associations or partnerships are made up by all members of the association. So we have to work for the benefit of transforming education, obviously to change paradigms, and not only in education, but also in the educational surroundings of the education itself, because that would enable us to share resources, attain more goals, and obtain more satisfaction out of those who participate in it. I would like to highlight that in the first publications of the Ibero-American Educational Research Network of Ibero-America, analysis and publications have been made on all the experiences that we have in Ibero-America of transforming education. So this is a point that we can use as a starting point in order to turn these proposals that already exist, which are already a reality, to be observed by other countries and to be implemented for their improvement. And this is as far as I would go. That's it. Thank you. Thank you very much. 5 minutes. That's good.
Yes.
So who is next?
No. Primero, gracias por la invitación.
First of all, thank you for the invitation. I will specifically concentrate on speaking about the region, my country, what we need to do in order to mobilize and move towards universal health care. When we detected in this study that the curriculum had that approach, we were in the mission, we identified the mission, we had a group of professors who were working in order to attain that, and I believe that the time of turning that into a reality, the written document is okay, but when we come to turning this into a reality, we realize that this doesn't happen because of several reasons. It is a complex phenomenon, the approach is complex, it has to do with health and educational policies, and it has to do with scenarios. One of the elements that is missing is interprofessional work. We cannot approach that phenomenon with one discipline, and if we continue teaching only one discipline in nursing schools, then we need to change that idea of only hiring nurses in order to teach other nurses. What we need to do is bring in other professionals that have a different outlook, but let us be careful, headed by nurses. It seems to me that this is something important. Nursing is a discipline that could lead projects for primary health care. And I believe that this is one of the elements that we have to work on, but also to make that work visible. If we only have it in our discourse and we don't make it visible, and since I believe that visibility is seen with an evaluation, so assessing, evaluating the results of these practices, incorporate the technology, these scenarios for clinical practice, for example, that are being exclusively done in hospitals, we need to do that from a simulation. The scenarios for simulation in primary health care should be modified, not only for acute events and others, but the work with the family, with intercultural work, for them to see these elements from the point of view of practice in educational institutions, but that later on they can find a scenario with a clinical tutor, someone who's excellent in the community. It seems to me that the models to be followed, if we're not heading them and pushing them, might not have the expected result in students in the coming years. Very well, thank you. Greetings from the Colombian Association of Nursing Schools in Bogota. And I will concentrate on 2-3 issues. I believe that when you read the article and you hear the presentation that was made by Dr. Cassiani, the question is thought-provoking because you start thinking about the different issues that would be needed in education, in nursing education for universal health care, and they're all very important. Also, just like Dr. Sarate did, I will concentrate on the country, and there's some issues that are striking there. The first thing is clear in this article, which is the heterogeneity that we find in countries regarding political, economic, social, and cultural aspects for nursing education. But this diversity, this heterogeneity is not with countries only. It is seen also within our own countries where we find regions, in my case in Colombia, the central region with large developments in nursing education, and other remote regions to the north and to the south that maybe might need support in ICTs and in other issues such as preparing the group of professors. And I believe that associations there play a very important role in order to pull, to support, and to promote these processes. So the first thing we would have to do is to do away with the barriers that we have in education, in nursing, and to move forward towards a coverage in nursing education as well. Secondly, I would also like to mention the model of healthcare proposed in this period by my government. For us, it is a window of opportunity because it gave us the possibility to establish an intersectoral dialogue between the Ministry of Health, the Educational Center, associations, academic units, regarding what the profile of the human resource in nursing is, the one that we need. Also regarding the profile of the other professionals in nursing, because I believe that there's a call here to no longer be inbred, that we have to look at inside, but also look at the outside in order to hold a dialogue with other professions. That is very, very important. The new proposal, when we speak of interprofessional education, needs that. And so for us, this has been an experience, a new experience. I believe that this has been a renewed experience, which has allowed us to establish a dialogue between all those professions in order to move forward to those profiles. I would also wish to underscore the need that comes out in not losing sight of the advanced implementation of advanced practice in nursing. This is also another window of opportunity so that in nursing we can have better interventions with more participation and to move forward in that universal health care. So I believe that advanced practical nursing is something that we cannot lose sight of. There are experiences in Chile, for example, where they've taken that step. There's a publication in the Public Study Center in Chile, November 2016, that promotes what the essential issues are that with advanced nursing practice could be taken for universal health care. We have maintaining the motivation with nurses, maintaining competencies and skills at the highest level. We have the recognition that we will have within the health system to optimize the medical agenda, inter alia, which I believe is essential and should be considered in order to deal with the universal health care or universal health coverage. I will speak English because of the time. 3 minutes is not a lot of time.
Thank very much for the opportunity to participate. This has been a wonderful team to work with. And we know that there are limitations to the study. We had not as many respondents as we would like, but we feel that the ideas that we learned can really have some implications to move us more towards preparing students for universal health. And I would like to just highlight a few of the findings related to the structure, process, and outcomes. Not to repeat what others have said, I very much agree with Laura and Rosa, Fabiola, Silvia. In terms of structure, I think the idea of recruiting a diverse student body and diverse faculty so that the graduates are reflecting the societies that we want to serve is something that we could perhaps pay more attention to, and ensuring that our students have opportunities to work with diverse communities, interprofessional as well as transprofessional. In many countries, the primary care workforce is not only physicians and nurses, but it might be community health workers, it might be curanderos, traditional healers, and I think to think outside the box for the future so that our students truly are engaged, and our faculty are engaged in working with these diverse communities. And I wanted to share a beautiful example. Several years ago, I had an opportunity to live in Chile as on a Fulbright scholarship at the Pontificia Universidad de Chile. And one of the community health faculty members there had been working with a community health center and noticed there was quite a large indigenous Mapuche community living in Santiago, and very often they would not take their children to the health center for vaccinations or other care. And she, working integrally, this is part of universal health coverage, integrated health care, worked with that health center so that the Machi, the traditional healer of that community, actually became a member of the community health center. And he had a traditional house built right alongside the health center so that when parents brought their children for vaccines, they could then go right to the Machi. And that, I think that's a beautiful example of integrated health care that relates to what we learned in the survey, the need to have more diversity of experiences, more diversity of students. So I wanted to point that out. Another thing I wanted to emphasize, which I think is really important here in the United States, as well as around the world, is that our students learn much more about health policy and how to advocate for universal health. As many of you know, we're having a lot of struggle in our own country in the United States right now. We do not have universal health coverage and universal access to health care, and we're likely to have even less of it. Preparing our students so that they can have a seat at the table, as Laura said, that they can be leaders and advocates, I think is something that I'd really like to emphasize. I've been working with Sigma Theta Tau internationally. There is an advisory panel called GAPFON, the Global Advisory Panel on the Future of Nursing. And we hope that the findings from that panel, which resulted from regional meetings in all seven regional meetings in all WHO regions, hopefully they will be ready in July. But one of the key elements is what Laura talked about, leadership preparation, so that our students have a seat at the table to promote universal health coverage. And lastly, I don't know if my 3 minutes are up, but I encourage all of you, if you haven't already read the report that Silvia mentioned, Health Professionals for the 21st Century, published in 2010 in The Lancet. That's now 7 years old, but I think so many of their recommendations really are relevant. And I'm going to highlight 5 of them that I think are pertinent for today. 1, greater integration of health systems and education systems. In so many countries, we have a Ministry of Education and a Ministry of Health, and they don't often collaborate very well. Number 2, promoting competency-based and interprofessional education. 3, promoting accreditation, as Laura's mentioned. 4, promoting sharing of resources, including digital resources across institutions and countries. There is a global digital divide, and many of us are developing courses online and feeling like they're ours. We're not going to share them because, you know, we've developed them. I really think we need to be more open. We have MOOCs, massive online courses, and Coursera. I think universities are going to fundamentally change in the next 10 to 20 years, and we need to be more open to that sharing. And then lastly, it says in this report, teaching students to work with diverse members of healthcare teams appropriate for local context. Thank you.
And I would like to add the virtual campus of public health to as a opportunity to the students, since there are many courses over there.
And thank you again for this invitation to be part of this panel. I won't repeat what my colleagues have so already well said, but I wanted to mention a couple of things that I think are recommendations to improve nursing education, and one of them is to improve the quality of the educators. I think that it takes a tremendous political will and investment within universities, within schools of nursing, but it's really essential for us to increase the number of our faculty members, our teachers, who have higher degrees and who have masters and PhDs. You will maybe have noticed in the findings that were reported that less than half of faculty are prepared at a higher than bachelor's level in most of the countries that reported. So this is an area that needs to be addressed partly because when we're talking about interprofessional education, interprofessional collegiality and practice, those professions who have a standard that's a higher level of education don't view nursing with as much respect when we don't have the educational level to support ourselves and our voice. So I think that it's essential for us to invest in educators. We also, that takes sometimes collaboration because they need to be sent maybe to a school in another part of the region where those programs are more available. But that is an education or an investment that can bring those people back to their own home country, and they would be prepared to start graduate programs or to teach in graduate programs at home. So it's worthy investment. A couple of other things. I think it's very important for both faculty and then our students as well to be quite familiar with the underlying principles of research so that they can appraise what is good evidence on which to base practice. So if professors and educators are not comfortable in evidence-based teaching methods as well as nursing practices, they're not going to transmit this confidently to the students. And yet, without science behind our practices, all we are nurses that just do things the way we always did them, and we won't be able to talk on an equal level with other professions, and we won't have a voice at the table because nobody wants to hear anecdotes. They want to hear evidence. And then the last is, for primary health care education, we have to be involved in communities. Our institutions of higher learning can't be silos where we're just school, sitting in the community but not involved in the community. Because in order to find placement sites, to know about organizations that might welcome our students for clinical placements, we have to know who's out there in our midst. They also have to know that we're willing to be part of their process or take up their agenda to provide services for the community dwellers or residents that they serve. So those practical experiences can never really happen unless our faculty get background and get to know the organization and then reach out to them to bring students. So those students then can be taught to work with the community members to assess their priorities. Just as I think sometimes as faculty we need to look at our student bodies and learn the priorities. What kind of nursing practice will they be having and what do they need to know to deliver this type of care successfully and safely?
Muchas gracias por las respuestas. Thank you very much for your responses. I believe that this was widely mentioned, interprofessional education. It was widely mentioned by all of you and other issues that still have to be analyzed. Please, we ask you to please give us your name so that the people who are following us virtually can identify who is speaking, who is responding. We now have 149 people connected online. We know that many of these have groups of people sitting there, so please, 200, 300 participants that are following us online. The second question then is, what is the current role of nurses in primary health care settings? And how should the schools prepare them? Aside from this, we'd like to hear from you. How can we better incentivize and increase and align education models with healthcare, which is something that you mentioned, how to align education and services.
Yo creo que este es un tema.
I believe that this is a crucial issue. It is something that clearly shows up in the study. On the one hand, I believe that although the curriculum has included elements of primary health care, the reality doesn't reflect that. But on the other hand, there's an important role of schools and universities so that models, healthcare models that exist, or those that prevail in our countries, not necessarily live up to the needs of the population. That is very difficult to change. It is not only something that depends on us, but I believe that there should be follow-up monitoring for decision-making. There should be nursing leaders, people who work in health ministries and education ministries in order to make these compatible. And for that, we need training in leadership. I believe that it is necessary. Not everybody receives the information. We find out in executive levels, governing levels, but not necessarily nurses and clinical services. So I believe that some work has to be done with them, leadership, training, perhaps a graduate course on being trained, another course from university, so that nurses in community services and primary health care through technology might be able to take these courses, follow the information, and have a massive campaign in our regions in order to keep nurses informed in the different communities. And the school to approach the community in order to make this work visible with these members of the communities. There are different actors. We have directors of schools and health institutions, nurses who work in the communities, professors, but also politicians. So all of them should be kept abreast about this model that we're working on currently. In our country, the model is for curative purposes, much less for preventive purposes, and that is learned by students. And they think that that's the normal, and that when they graduate, they will be working in a big hospital, a big healthcare curative center in a specialty because they're the best paid, a specialty in a hospital, be it surgical, adults in critical state, pediatrics, etc. But very few incentives or very little visibility is given to primary health care model that exists in each country. So I believe that we have to work on the one hand with nurses, with successful experiences of nurses that will go with our students, and for our students to have a real or virtual approachment, and that they do this either nationally or internationally, because there are several scenarios where this model is being followed, and for they themselves to be able later on with that learning to transform their direct scenario and then the larger scenario. Very briefly, Laura Moran, President of Aladesi. I see that all those here in this panel, we are educators. We go to nursing schools, and education is very important, and it is acknowledged as a driver for development. But especially when we speak of the current role of the nurses in primary health care, I am pondering upon the fact that we need to acknowledge the multinational nature of health and populations. We can't think that it is enough to change education paradigms in nursing. That would be part of it only. We also need to look for paradigm changes in other fields. For example, in many of the countries in Latin America and the Caribbean, we don't have integrated health systems. It seems to me that this is a niche that is not to our favor. It is not a favorable niche for primary health care. But then we need to acknowledge in Latin America and the Caribbean that we need to move forward to legislative transformation of government policies on health and education and labor force, inter alia. We need to work, as I said previously, on regulation of education and nursing practice, on the working conditions that the nursing staff has, how we develop or how we promote the development of human talent in nursing, how pleased are users of these services of primary health care, how pleased are the professionals themselves and the employers and other things. Fortunately, within that huge mosaic in Latin America, we also have experiences in Latin America and the Caribbean of countries that have made headway on that. Maybe we could mention the case of Brazil, where the single health system with its own uniqueness, specificities, and problems, it has been an experience that has enabled us to visualize how we can have successful experiences when the health system can support and can back up all these processes. I believe that increasingly more in Latin America and the Caribbean, we have evidence and good practices, lessons that we can learn and that we could take as benchmarks in order to move forward in some other countries where this is still not a reality.
Gracias, Laura.
Thank you, Laura.
The mosaics that you see built in the health system and in the countries that we practice in, I also see the mosaics within the profession of nursing, even in primary healthcare settings. Because I see that there's several levels of nursing that are practiced or can be practiced. There's the potential for primary healthcare practice by nurses who have less than a bachelor's degree. They can provide direct service, they can do screenings and health education, they can work with and support community health workers. But then there are those who have more education, who have a bachelor's degree, and if they're employed in primary health care settings, they can do a great deal in addition. A lot of client education and supervision of the other staff, but referrals and coordination with their interprofessional teams. Then there's those with master's degrees that can actually manage the facility, manage client care. Those who have been educated to an advanced practice level can provide 90% of the primary care that's done in these settings. If our countries legislate and allow them to practice to the full extent of their education, nursing could revolutionize primary health care. And I think a paradigm shift is needed for not only our governments and our institutions to see nurses as capable of these levels, but of ourselves. We need to understand that our scope of practice should reflect our education, that we shouldn't sit down and stay silent when we know we have training and skills and competencies that we're not using in our work. It's important to invest in our education, but it's also important to take advantage of what we have and use it for the betterment of our society. So nurse-managed clinics are something that could really improve health care, access to care, universal care, because there are many places in my country and in most countries where the distribution of health workers is very uneven. There may be no physicians whatsoever in certain areas. I know it's true in the United States. And we need to or educate ourselves as nurses to the competencies that we need for practice, and then take responsibility for exercising critical thinking, making scientifically sound clinical judgment. We need to not just think, well, I'm just following orders. We need to think about our patient outcomes and take responsibility. I feel like as professionals, we will become grown-ups when we do that.
Bueno, yo voy en el orden de la doctora Linda.
Just as Dr. Linda said, and I think we saw this in the study, and that is that there has been a great effort made in post-graduate education. Among professors, we have ever more professors with master's degrees. In Columbia, for example, the minimum degree that you have to come into the university is indeed a master's degree or a doctorate degree to teach in our nursing schools, and that's very important. And I do think that bears mentioning, however, the fragmentation of healthcare services has led to a fragmentation of education. Even with these levels of education, we still haven't achieved much visibility in primary health care. The study shows that clearly. What you see here is that the role that we have as professionals in primary health care is something that we need to review and take a closer look at. We have to rebuild these bridges of communication with the different primary health care centers so that we can get a good reading on what the skills are, not just in the academic sector. There has to be a cross-sector dialogue, and we have to approach the community and ask what leaders there are, what leadership skills are needed to ensure that we have an inclusive participatory leadership that takes into account the community and its needs, and that makes it possible for us to dialogue and interact with all the different actors in the healthcare sector that come together. And as Dr. Linda said, this calls for better preparation in evidence-based nursing so that we can bring to bear more competent interventions that are more credible and more to ensure that our interventions are something that are more conclusive in the community.
Linda Wilson, Emeritus Professor from the University of Alabama in Birmingham. I agree with all of the comments and wanted to build on one about that Linda McCreary was talking about, each professional being able to practice using their full competency, because in the United States this has often been a challenge for our advanced practice nurses prepared at the master's level, nurse practitioners, nurse midwives. Because of differences in regulations in different states, they sometimes cannot practice and make the maximum contributions to universal health. And as Linda said, this applies to all levels of nursing education, and I think this is true in other countries. So that's something I think that working legislatively, again, preparing students as advocates would be important to address. Some years ago in the United States, the National Advisory Council on Nurse Education and Practice looked at the 5 essential roles in primary health care and noted, if you think about these 5 roles, at many levels, the contributions that nurses can make. One of them is integrating care. One of them is increasing accessibility to care. 3, addressing a large majority of personal health needs. 4, building sustained partnerships with patients. And 5, practicing in the context of family and community. And all of those, when I think of them from the very basic nursing education, this is what we teach nurses to do. So we're very qualified, whether it's working in hospitals, community health centers, schools, other nonprofit or community-based organizations, schools, outreach, working in advocacy, all different areas nurses can make contributions to primary health care. this National Advisory Council recommended certain aspects of education that could help prepare nurses to make these contributions. We've mentioned many of them before. Interprofessional education is key. Enhanced clinical training in community-based settings. And some places are even thinking of internships or residencies in primary health care. I really like the idea, I think, I forget who mentioned it, Laura or Rosa, about, I think it was Rosa, about interdisciplinary diploma programs preparing nurses and others, and perhaps nursing can take the lead. I've seen such programs in Brazil. And I think looking, as you mentioned also, Laura mentioned, the model of family care in Brazil through the Brazilian health reform, I think is something we can all learn from. The National Health Service model in the United Kingdom. My daughter lived in the UK for 16 years, and after each of her 4 children were born, a health visitor would visit the home and do an Edinburgh depression inventory to look at postpartum depression. And then there were visits regularly for the first 6 years of a child's life. This is a nurse participating in primary health care. Most of these health visitors are linked with family physician practices along with social workers and other health professions. So I think there's a lot that we can learn from other countries and build in our own countries to enhance universal health coverage.
Muchas gracias. Hay una pregunta aquí de Perú.
Peru has a question sobre communication and information technologies. And Peru would like to have you talk more about this as an integral part of education. What do you think about the use of information and communication technology in nursing education? And perhaps you could talk a little bit about the issue of distance learning in nursing. Certainly, I think that technology should be used for this purpose. I'm Rosa Zarate. I'm sorry for not introducing myself. I'm from the National Autonomous University of Mexico, and I am heading up the collaborating center of that school, UNAM. And I do think it's important. These different technologies, the scenario that we have available for the purpose of training, and that technology is also be used in providing primary health care. There are many examples of this in our school in which technology is used for teaching and training nurses. This is a strategy that we have adopted for a number of years, 45 years now, since we have been making use of distance education and also teaching nursing in the forest-flung areas of our country, in which sometimes the only healthcare being provided is done by a nurse, not necessarily a professional one. Oftentimes, these are technically trained nurses or nurse assistants who are working in the communities. And so this distance learning through mobile apps is the type of education that we also need to offer in this primary healthcare strategy and training community leaders, or that it actually be a nurse. I'm imagining someone with a master's or doctorate degree who might have under her a number of primary healthcare nurses that she could be advising at different times in consultancy, working with the family, and that would be a very good practice, incorporating those technologies. Now, what we see in our countries by way of training, where there's a shortage of human resources in primary health care and at the community level, this calls for an intensive use of technology. So I think that's a very good idea for us to make use of that and to ensure that This is a means whereby the most experienced nurses can offer support to their colleagues working out in the communities to help the families, mothers, and to make use of technology to stay in touch with the population, not just for educational purposes, training of nurses, but also to reach out to children, families, the mothers. All of this can be an excellent strategy. Laura Moran, President of ADEFI. I wanted to talk about the use of communication information technology, which was the question that a colleague from Peru has just asked. And I would like to point out that, yes, I do think it's absolutely necessary for us to make better use of these technologies, as long as we consider that these technologies are simply a support tool. But behind the use of these technologies, there should be a didactic, pedagogical proposal that backs that up to ensure that these technologies can assist in the learning and teaching process. Now, this is tied in, although it's not exactly the same thing, but tied into distance learning for nurses. And this is something that's being debated in some countries, in which distance learning for nursing is being called into question. And they're asking whether it's useful or not. And on that, I think that we have to talk about distance learning as an educational proposal that would be at the quality, that would be quality with a systematic evaluation and formal evaluation processes. That's the only way that we can ensure that we are truly transforming people through this education, people taking part in these distance learning projects, that they're actually learning. And for this, there have to be very useful projects, which certainly can be fabulous, but what we have to do is ensure that we can get better, more and better nurses in those far-off places throughout our countries, and again, making sure that this is done at the highest quality. But certainly this is something that can help us to favor better access and coverage of health. I think the use of technology can be very useful for telehealth, telenursing. So that we can ensure that the knowledge and expertise of expert nurses can reach the far-flung places, and technologies certainly is a very useful tool for that purpose. But I'm adamant about this. There has to be a clear, didactic, pedagogical approach to ensure that this is done properly.
I agree with those comments. I'm Linda Wilson from the University of Alabama in Birmingham. At our university for a number of years, all of the graduate programs have been distance accessible, meaning it uses a hybrid approach of online learning as well as students coming periodically to the university. And there are many excellent buenas prácticas to create a community of learners, but I think when we think about transformative education and some of the ideas and recommendations about active learning, it's critical that if we move towards more distance-based education, that we make sure to use those strategies that Laura is mentioning. And there are many ways that can be done. And I'm in favor of distance education, but I have taught many times classes where the students, we try to create discussion boards and the students simply write, I agree with so-and-so, and it takes a lot to really try to engage students and create an active learning community. And I would say that that would be our challenge. But I'd also like to say that I think it also opens up doors to promote much more collaboration, which we've also talked about for universal health coverage, sharing resources across universities, learning about primary care models. In my own one course that I taught about developmental care of preterm newborns, Laura and Rosa and I have worked together on a study to identify global health competencies. So I'm always interested in how to give my Alabama students a bigger world vision. So in some classes, I would invite the nurse manager of our neonatal intensive care unit in Alabama, at the same time inviting a nurse from the neonatal unit in Lusaka, Zambia. And it's a wonderful opportunity to use technology to expose our students to the wide diversity of practice and give them an appreciation. So I think technology has great opportunity, but we need to harness it appropriately.
I agree with Laura and Linda in what they say. I do think that information technologies and distance learning is a great opportunity for coverage so that we can reach, again, those far-flung areas and share, to offer a further field of training for nurses. I do think it's very important for us to clarify that both for the use of ICTs and in distance learning, there has to be very rigorous training of the professors who are going to use this technology, offer this type of distance learning education, because these are different methodologies, different approaches to uphold and preserve the quality of the programs, the level of education that we are offering. So it's very important, beyond just thinking about whether it should or should not be done. First and foremost, you have to properly train and prepare your professors if they're going to use this type of distance learning.
This is Linda McCreary from University of Illinois, and I will not repeat, but I will agree with what my colleagues have said. I think there's not a question of whether distance learning. I think because of the advantages of opening up the educational arena to a much broader audience, it's here, it's going to stay. We have the technology. What we don't necessarily have are the expertise and the pedagogies that help us to understand how to include this set of techniques in effective teaching learning experiences and how to engage students in interactive learning so that they are actively involved in their education and also with each other. I think that we're understanding more and more that team-based learning, where the students dialogue around a problem and come up with solutions, test them out, and select the most effective, those are important aspects as well. So we need to, we actually need more research into what are the most effective ways of using these technologies for nursing education.
Thank you for those responses. On this topic of technologies that calls for preparation of professors, we have another question, which is, what do you think the main factors are for teacher training, educational practices, and different learning scenario to achieve universal health?
And I'll start us off here. Faculty development and preparation is critical all over the world. And I think we have a lot of wonderful resources that we can use. And one of the first steps in faculty development, whether it's for universal health or whatever, is to identify competencies for faculty. In 2016, the World Health Organization conducted a Delphi survey to identify what should core competencies be for nurse educators, and they published these competencies, and I think that is a really good place to start. Here in the United States, our National League for Nursing also has published a list of core competencies for nurse educators, and they actually have a certification exam for educators. And this is something that faculty at my own university have considered and taken, and it's a way to give advancement for faculty to help them in their continued professional development. The WHO, in their document with competencies, also had some recommendations about what are the basic prerequisites to becoming a nurse educator. And I think these would be important. I know in many countries, including the United States, people join nursing faculties. Maybe they have a master's or a PhD degree, but they have never had a class in how to teach. And in many countries, this is true. You know, nurses might be excellent clinicians. They're really good in the clinical area, but they don't have the teaching background. So the WHO says that faculty should have completed not only a recognized nursing education program and be clinically competent, but they should acquire formal education either before or soon after they join a faculty in how to teach. So schools of nursing, I think this would be a great way we can collaborate together. Maybe we could develop online faculty development programs. I know Dr. Cassiani has talked about this as an initiative of PAHO. And I also think there are some great networks of nursing faculty. The International Council of Nurses has an international nurse educator network, and there are regional networks in all of the 6 WHO regions. And this network has various discussion forums. For example, in March 2017, there was a forum on migrant education in Europe. The current migrant and refugee crisis has huge implications for universal health. When you think about 65 million refugees globally right now, the biggest refugee crisis since World War II, and how are nurses involved in that? How is nursing education involved in that? So those are some resources. Lastly, I wanted to share an experience Fabiola can share personally, but I think there's a real need to do a better job of integrating nursing education and practice. And I had the privilege several weeks ago of participating in a very innovative diploma program that has been launched in Colombia. It's a 9-month program to promote better integration, alianza entre docencia y servicio. And in this program, 7 universities and associated university hospitals in Colombia have identified teams, 2 faculty and 2 nurses from service, and these teams are participating in a distance-based educational program where they have online classes, but they also come together for 2 days every other month. I participated in the 3rd meeting several weeks ago in Cali, and each team is working to develop an integrated model of care to improve nursing care in their particular hospital-based setting. But I think this model of linking practice and service and now moving to community-based settings, looking at best practices for how we can promote these alliances really has potential. So I would like to applaud Colombia on that program.
Felicito a Colombia por ese programa. Laura Moran. I agree with what Linda just said. Being a good clinical nurse doesn't necessarily make you a good teacher of nursing. And that's why we should think about enhancing the pedagogical training and background of professors, not just for nursing, but in other disciplines that also come together in medical fields. Now, in the particular case of training teachers for primary health care, I think that in addition to this, have to be other elements present as well. Professors in primary health care who are capable of offering support and bringing about methodological cognitive awareness that students in nursing need to have so that they can actually provide primary health care. Because while it's true that all nursing students should be trained in critical thinking and know how to identify and solve problems for decision making and so forth, I think that in the particular case of primary health care, there are some additional skills and competencies that need to be taught to favor that particular environment, because if in the clinical area where everything is more controlled, there are still uncertainties, there are conflicts of values and other situations that arise that make offering a healthcare complex and nursing complex, I think even more so in primary health care. It's even further complicated, reason for which other skills have to be taught and brought to bear that make it possible for this to be done successfully. Now, something very crucial that we do need to take into account is that professors of nursing that are teachers and professionals should do their teaching based on evidence. They shouldn't just be nursing teachers assuming that it would be a great thing for the students to learn to do this, that, or the other, but rather that they should seek out the best evidence in literature that shows how to achieve this. That is, to ensure that the learning process is that much more successful and rooted in evidence. Now, something else that's very important is for teacher training in advanced nursing practice to move forward, as said. But this is also important, that is to train professors so that they themselves can then teach others how to be advanced nurse practitioners. Rosa, we're waiting for the assistant director of PAHO to arrive. As soon as he arrives, we'll be giving him the floor, so just wanted to give you that heads up. I want to try to be optimistic and to highlight the experience that many of our countries have, and I'm talking about the transformation that health has undergone without there having been a policy to this effect. That is, what have we done, those of us who work in health? What have we done, and what do we see in our populace? Now, as Julio Franklin said, our healthcare system and the progress we've made in it is evident, and what is happening in our systems is that it's necessary for us to enhance coverage and universal access, yet that has a lot to do with how the population has developed. We've got aging, we've got more chronic ailments and so forth. Before, we were more concerned about diarrhea in children, respiratory ailments, and heart disease and diabetes. But I think that this is forcing us to change how we teach, as well as how the system itself is organized and who is running the healthcare system in the communities.
What would happen to our countries if the nurses had not done a good job of immunization? What would be the situation in our countries if nurses had not taken care of deliveries with the traditional midwives and professional midwives as well, with curanderos in the regions? They didn't know how to use a tea in time, or a cloth, a piece of wet cloth in order to bring down a fever in the community. I believe that we have different experiences in different regions of the world in primary health care. So what do we have to do? We have to recover that. We have to recover these experiences and these nurses that operate in the community, to join hands with them, with nurses in education All those of us nurses in the educational sector should recover these experiences from these nurses that operate at home in the different scenarios with a little suitcase with the immunization vaccines, working with the mothers in order to breastfeed children, working with the schools. The nurse who used to be in our schools, I knew the nurse in my school where she arrived, and we used to hide because we knew that the vaccine, the immunization was coming. We have to recover that nurse. So we're not inventing the model. We're simply redoing, we are re-engineering the model because the conditions are different. So I do believe that what they have to teach us are the nurses in real scenarios, together with the professors that have masters, PhDs, ought to be recovered with this model. We in our school have begun 15 years ago an educational proposal of clinical tutors, experts, where they are the experts in the scenario and the professors are the experts in education, in the pedagogical training and doing good assessment. But we couldn't do this if we don't have these nurses that day in and day out take care of that work. So I believe that putting together teachers with the service, the two together will become a strategy and a change in paradigm on how to teach an education that will transform the clinical scenarios, that will not only transform education, but it will transform the learning scenario for students. Thank you very much, Rosa. We're here with the presence of Dr. Francisco Becerra. Dr. Francisco Becerra is the Assistant Director of the Pan-American Health Organization. And we are coming to the end of the session. We have Dr. Becerra here, the authors of the study, Dr. Linda Wilson, Lauda Moran, Linda McCrary, Fabienda Castellanos, Linda McCrary, Laura Moran, Rosa Zarate, and I will call Linda to come up to the front. We have 150 people following us online, but we know that there are many cases where the person has the name, but there are different groups participating, so there's a large group following us online, and I'd like to thank each and every one of you, those of you who followed us in celebrating the Nurses Day, the International Nurses Day. It is the third time that we're holding this celebration. It's the third year in a row that we're celebrating. Thank you very much virtually, and I'd like to give the floor to Dr. Becerra, Dr. James Fitzgerald. Thank you very much. Good afternoon, everyone. I have a certain bias, and I have to tell you about it because I've told you in the past when I've been invited to participate in celebrating the International Nurses Day, especially because during my medical career, I had the honor of working with the nurses at the National Cardiology Institute in Mexico City. And perhaps it's one of the institutes where nursing has its own mysticism, very special mysticism, and the service to the patient is something that you live through, that you absorb, that becomes part of you. And that left behind many teachings. For my career as a physician, it taught me to listen, to take a better look at the patient, because nurses, they're the ones who establish that bridge between the patient and the physician. And many times the doctors just go by, they check, they leave notes, and they leave. But those who hear, who follow closely, who take a look at the patient, who see the development of a patient, and those who detect these changes are the nurses. And that part, I'm very grateful to all nurses. The nurses at the National Cardiology Institute at the time for the teachings they gave me for my career as a physician, because I learned things that other colleagues never knew or were never going to learn what to do, such as place central catheters to handle intensive care equipment, things that you learn with nurses. You learn of that through nursing work. And also to be able to change beds, bedpans, and it's very helpful at home to do housework when you live on your own. But on the other hand, the head of the nurses in the health center in Comonfort, Guanajuato, the health center that was called the Bustamante, and the name changed. One of the greatest pillars in public health in Mexico, who taught me public health, who taught me through an immunization campaign the value of a public health, and that after graduating from cardiology and having worked in intensive care, post-surgical care, my idea is that I wanted to do intensive care as a specialty. And after working with Christina in the health center in Comonfort, Guanajuato, I decided to go for public health. And it is thanks to that change that brought me to PAHO, because of my activities in public health that got into me in my veins, and I continue to enjoy that and to live through that here. And I still try to contribute in my professional life to the health of many people. The work in engineering in any one of the fields where this is done, be it primary health care, specialized in major medical centers or in public health, or as midwives, in many of the specialization of nursing as a midwife plays an important role. And the work of nurses,
se les reconoce por la importancia que
they're known for the importance that I said you had, that sensitivity in listening to the patient and seeing the changes in the patient leaves a lot with us. It enriches us in the medical profession of what you have to do, what you can do. A lot of what we owe to the recovery of patients is because of the service that you provided to patients day after day in giving them their medicines and making sure that the tests are performed, etc. However, I'm also very pleased to see how nursing schools offer increasingly more and increase the level of training in the nursing profession. What used to be a technical profession many a times,
en enfermería.
now we have PhDs with surgical specialties, pediatric surgery, but that is really striking to me to see how this profession has been strengthened and moving forward in such an important way in order to contribute from the point of view of research on nursing, which is very important in order to take that part of evidence to help us do a better job in our daily work. There is a total of 1,280 nursing schools, according to recent polls here at PAHO, our colleagues, and throughout the entire region in the Americas. 1,283 nursing schools in the Americas. And I would imagine that we find all sorts of schools, really very good schools, and those that are more or less good, and others that are not so good. And that also attests to the work that has to be done in order to move forward in improving the quality of those graduates. And that's another one of the challenges that we have in the region, not only in medical schools, but in nursing schools. How can we make progress so to see that the quality of the human resources that will work in the first level of care, in the second level hospital, third level, or in super specialized centers will truly come out with a robust training that is needed in order to take care of the population in any one of the different scenarios that we can have, working scenarios. And the development of curricula is important, but not only the development of the programs and the literature that will be followed in schools based on the curriculum, but for the professors to be top-notch professors. If the professors are mediocre, the graduates will be mediocre. If you have excellent professors, then the graduates and the nurses will be excellent, and that's important. What can we do? How can we find those excellent professors that will enable us to transfer that mysticism of nursing, that closeness with a patient? What is needed in our daily work as a team, as a medical team, nurses, doctors, social work in different areas in order to take care of our patients and to bring them the medical services that they so much need. That when we hope that we turn off the light, hopefully the light will shine and will be transferred to all the new nurses, men and women nurses who are graduating, and may that light grow and shine, that this become a beacon of knowledge, a light that will bring us closer to better specialty, better work, and better technical capabilities in order to see that. I'm very pleased, very happy to see such a good team of work. I must say that there's an imbalance of gender because there are men nurses, and I don't see a man nurse sitting here at the head table. Hopefully there are a lot of men participating online, following us online. I'd like to commend you for this initiative. I'm very pleased to have you here at PAHO. The work we do with you, Linda Wilson, Rosa Zarate Grajales, Linda McCreary, Fabiola Castellano Soriano, Laura Moran, thank you for being with us. Your knowledge is important, being able to share what you do and how all of this has made headway in the Americas is very important for us, particularly now that in the cycle of governing bodies we will discuss the human resources strategy for health within the universal health care and universal access to health. And nursing plays a very important role. It is not only the physician, but also nurses. But we must also think of the intermediate technical careers. This region is not moving forward at the same pace as we have in other regions. Technical careers in the medical field, intermediate careers, where not everything has to be medical, not everything has to be within the hospitals, and that is also another challenge for nurses in order to move forward. I'd like to thank the HSS department with James, Silvia Cassiani in particular, our advisor in nursing. It is very important, Sabrina Sosa Elias, who's also contributed and made sure that all of this is working okay. And one more time, a nurse brings with her the spirit of nursing for things to work out. If there's someone who keeps things in order, and I learned this during my times as a nurse, it is the way in which nursing keeps records, where they have the change in shift, they report on issues, and Silvia does an impressive job with that. I must tell you that Silvia is the advisor where they have more collaborators in nursing, and that's a great concern to me, and all of you cooperating centers, but I'm also worried to see that Silvia has so many cooperating centers, because I'm thinking the day that she retires, who's going to take care of so many cooperating centers? And this is something that we have to start considering. What are we going to do, Silvia? We have a lot of centers, and I don't want to lose any of them, but we have a lot of centers here. And I'm very pleased to see that we have so many collaborating centers in the region because they're very important, and a lot of work has to be done with you. So thank you very much for your presence here in PAHO. Thank you very much to each and every one of you, all those of you who have followed online, 150 people following us online, connections rather. Our statistics were telling us that usually we have 5 people per connection. So this means that 150 times 5, do your math, more than 600, 700 people following us online, which is very significant. So once again, congratulations to men and women nurses in this your day, and thank you for the work you do and for the teachings you leave with us every day. Thank you all. Con las palabras de Dr. With the words addressed by Dr. Becerra, we bring this meeting to an end. I would like to mention the presence here of the center, the colleagues from the Johns Hopkins Center, University, the Collaborating Center of the National Nursing and Obstetrics School of UNAM. The director is with us, Dr. Alberto Kleiman, here from PAHO. Thank you very much. And the entire team of authors, all those who are here, Carmen from Johns Hopkins, she's with us here, and our colleague from Brazil as well, who is here to be with us. I would like to thank my entire nursing team here at PAHO, the huge team that we have, that group of people that you see here, that is coordinated by Sabrina, by Emmy. They've put everything together today, and to you, who left your countries, your cities, to be with us today, sharing things with this large group of people in the region who followed what you had to say about your ideas, your thoughts on education and nursing. The article that is published today has already been published in the Latin American Nursing magazine. We already have the link, and this will be published tomorrow on the PAHO's webpage and within the nursing program. So thank you, everybody. And now we have a reception hosted for you in the lobby. Thank you.
Vamos sacar una foto el grupo que está, por favor.
Si sube la pantalla.